the needle I just apply. Without using the needle I just apply where exactly this Tuang is in. We just activate like this. So this point is entirely head and neck and heart, and then till the abdominal region he'll get the vibration. This called as a vagus nerve activation. Did I can cook? Okay, good. So this, if you are not using the needle, we can use it. Not bleeding, you are applying the 1 point. That's for the rheumatoid arthritis and also the osteoarthritis of the knee. Also applicable to use this point. That's the reason you just apply. Then SI2 point. I think you wanted to see. And Jayashri, you just apply SI2. SI2 is the Chiangu SI2 point. Where exactly SI2? Yes.
Yes, sir.
Yes. Yes. So SI2 and this is SI. Yes, SI2. So SI3, SI2. You just apply here 1 more point.
It got disconnected again.
Okay. And so let me finish it off. Give me the needle. Second needle. Okay, देख लीजिए. So whenever you get the opportunity to see.
Just hold it and come.
पता है ना. Yes. Now we will proceed. First point we already completed. Second point also we are just applying. Now this is the transverse palmar crease. So here you can find out there is a crease end on the medial side. This point, because there are the two creases there here. One crease to be known as a one crease, web margin crease. The second crease to be known as a palmar crease. But when the web margin crease, where it get terminated on the medial side, this crease depression. So where exactly there is the head of the metacarpal bone in the depression downwards direction, this is SI2. This is the proximal direct depression, SI3. So now we just apply SI2 point is the good point to treat for what condition? ACL also. Amyotrophic lateral sclerosis, and further this is the burning sensation in the urine and also shoulder related disorders. We just activate this point since this point is belongs to the grand numbness of the fingers too. Good. So SI2 is the great point. SI3 point is the Hooksy. SI3 is the master point, is the copulo-conventary, or it is communicating to the confluential point for the Dumai meridian. Spinal cord meridian, from here to here, spinal cord meridian, this will going to support SI3. Always you remember to apply this point SI3 on the right side. You just apply left side UB62, then you apply on the left side LU7, and then right side is the kidney 6 point. In this combination is advisable to use the points exactly which side you wanted to apply. That also sometimes it matters. Then SI4 point is located on the just at the base of the metacarpal bone, fifth metacarpal bone in the depression. This point to be known as SI4. SI4 is the good point for the scapula and then shoulder pain and also jaundice related disorders. But this point is communicating to the heart and then small intestine. Right. Now the SI5 point is SI4. Yes, SI4 the point is here. Then SI5 point is here. So where exactly this is the ulnar bone, just distal to this region, this point to be known as a SI5. SI5 is the horary point of the small intestine. This will going to help to treat for the small intestine disorder. By the way, for the entire opening of the meridian called as a SI5 meridian. SI6 to be known as a Yang-Lao. This for the most of the times. Please apply. Who are not applying, please apply you all. So please, I'll give the opportunity to everyone. Please, if you are not behind us, but we cannot do, please come forward to applying the point. Good. SI6 is here. Yes, SI6 for the emergency point to treat for the acute condition of the neck pain. For the suddenly happen, you wanted to treat, we just apply, and then strongly we can stimulate the electrical stimulation as well. So now the sixth point is over. Seventh point, how to identify this? From here to here, how many chun? 12 chun. So now I'm just holding from here to here. There is a 6 chun here. Then further from here to here is 3 chun. Then from here to here is actually to 1.5 chun. So there is the 5 chun. That means from exactly here the 5 chun, from 3, 4, 5. 5 chun proximal from the wrist region on the posterior border of the ulna. So this point is good point to treat for what condition? nervous debility of the nervous SI7, always 7, you remember 7 is good point to treat for the nervous which is connected to the hand nervous system. What are the nerves are communicating? There are the 5 nerves are communicating. One is the phrenic nerve, musculocutaneous nerve, radial nerve, ulnar nerve, median nerve. These are the most of the nerves, important nerves are coming. Yes, you just apply this direction. Yes. So apply where the muscles are there, their muscles. You touch and then feel, you should not touch to the bone. Where the muscle flesh, that's the reason touch is very important. Where you are wanted to apply, there touch and then apply. Which deeper needle you wanted to insert, you get the idea about it. When you are just applying like this without touching, maybe you are applying in the other direction. Here muscles are there, here bone is there. Once you touches to the bone, yes, ouch, I do have the pain. But patient unable to give you the opportunity to apply the second needle. So that's the reason per se, lovably, happily. This called as the pain what you are getting is the sweet pain, not the sour pain. Sir, pain ಕೂಡ ಒಂದು ಸ್ವೀಟ್ ಪೇನ್ ಇರುತ್ತೆ ಅಂತ ಕೇಳಬೇಡಿ, right? So this is the called as a SI7. Then SI8 to be known as this Yohai, where the point is located. This is the olecranon process of the ulna, the medial epicondyle of the humerus. So you just apply the point to be known as a SI8. Please come somebody, you just apply this point. Good. So try to find out slightly more depression. When you semi-flux, you will get the good depression. Good. SI 8 point. Yaru hedirkonak hogbadi. Dayavitu please come forward and then at least apply one needle. At least apply one needle. We have the 21 points. You all of you try to apply one needle. Yes, SI 8 point is SI8 point is located midway between the two bones now. This is the sun point and sedative point, but this gives energy to the stomach, by the way. But any burning sensation on the chest region, burning on the scapula and then shoulder region can be treatable by activating this single point. Now we are coming to the next point called as the most crucial point. Now we completed the command points. Now we are coming to the non-command points which will be applicable. Today the most of the people are really suffering for the cervical pain and shoulder pain and scapula pain, neck pain and headache, cephalgia. Now I need to apply on the back side. So I think if you are sitting so which side is good for them also?
This is correct, sir.
So you just wipe it this entire region. So where the points are located. Now we just draw this point to be known as a SI9. Where is SI9? This is a SI8. Yes. SI9. One tune proximal to this region. SI9. Right? SI9. Then directly come. This is the inferior border of the spine of scapula. SI10. Now show. Then Tianzang. Now what you should do, you just take your hand to the upward direction. Now you can find the pit of the scapula, no problem. You can find the pit of the scapula, where end of the scapula. Now come this side, right? This is the end of the scapula, right? So if you wanted to do like this here, you can do. But however exactly you wanted to do, how you should do, you take this hand and then find out this is the end of the scapula. Please put it forward direction. Then now this is the end of the scapula. You come down and this is the spine of the scapula. This bone to be known as a spine of the scapula. This bone, this is the acromioclavicular joint. This is the clavicle bone. This is the spine of the scapula. You come directly. This is the entire region to be known as the spine of the scapula. From here to here, that means divided into 3. One part, lower 1/3, middle 2/3. This is the upper. This from here to here is the upper 1/3. This as a 2/3. This is the lower portion. Now the upper 1/3 point to be known as a SI11. Now you wanted to do as a triangle. You just use this one, this to be known as a this is a Chiansen. Chiansen means is the shoulders, true shoulder. Chian means is the shoulder, Chen means is the true. Then the now show point is the inferior border is the 10. This is the Tian Chung. Tian again is the heaven. Heavenly connecting to the breast is the heaven. So breast communicating point to be known as a Tian SI11, where the Ru Chen. Ru Chen, that means the Ru Chung you cannot apply. Ru means the breast, Chung means is the center. You cannot apply on the nipple. So the posterior side you can apply the point. Most of the times the woman says, I do have the pain on my chest region, on my, no, she says complain about only the chest is indicating yes, you cannot apply here. Better you can opposite side on the cloth, you clean it entirely, then you can apply. In USA it's not advisable to use on the cloth, is not prohibited to apply the needle. But however, in emergency condition you wanted to use, you can use it after cleaning the entire process on the cloth. So now hopefully we completed SI11. SI12, the point is located on the superior border of the spine of the scapula. You touch and then feel this is the spine, supraspinous fossa. So this point to be known as a vertically, you just come down, this point to be known as a 12 point, that's called as a Bing Feng. Bing Feng, that is called as a grasping the wind, to be known as a, that is the SI12. SI13, you come down, this is the spine of the scapula, where it ends, that to be known as a small intestine. 13, that's called as a Chu Yuan. This is side 13 on the medial side. Then further, these points are really zigzag level, it's coming. Then further 13 and then 14th point to be known as a Qian Wei Shu. Qian means shoulder, Wei means outer, Shu means the point. Outer shoulder point, where the point is located, 4 chun lateral to the, sorry, 3 chun lateral to the lower border of the spinous process of the thoracic one vertebra. How to find out? You just bend forward direction, you can find the C7. This is, you just, this is as a C7 below, this is the T1 below. From here 3 chun lateral to the spinal cord, then you just apply this point to be known as a, this point to be known as a, which point is it? SI14. SI14, this point 14. Again, there is another point, Qian Chung Shu. Yes, Qian means again shoulder, Chung means the central point. So now this is as a C7. From here, C7 below. C7 below, 2 chun lateral to the spinal cord. So this point to be known as a, which point is it? SI, good, SI15. So now you can see there is a W here. There is a W or M. So this indicating a zigzag type. You just apply even these markers which you will get in ECG, M or W is the very serious condition. You remember in that way, this also MW is existing here. In that way, the zigzag type energy is moving. Now this SI15. So SI15 is the Qian Weishu, Qian Chungushu. Hopefully we completed on the shoulder points. Whenever the patient complain about, I do have the pain in this region, scapula and then shoulder muscles pain and the levator scapula. This point is related to the levator scapula point, where the exactly the muscles where it get ended here, this point. But however, all these muscles get neck stiffness, that condition you can use it these points. By the way, for the breast disorder, then infraspinatus, and this is the teres minus the supraspinatus muscle. All muscles can be activated by activating these particular points. So hopefully, because today for the lifestyle people who work for the corporate level, they do have a lot of pain. Even that conditions, you can use these points, always is good. Now we completed this. Please you apply all these points, all of you. You select one point. Already I marked here. So there you just apply close to that point. Use all the one tune needle and then apply. After application, we'll do the electrical stimulation to those points. Wire stimulation according.
Sir, you told SI11 not to apply on the cloth. Sir, is it only for SI11 or applicable for all patients?
What we should?
SI11 not to apply on the cloth, sir.
On the?
Cloth.
No, you can apply on the cloth in emergency condition. For the breast, even for the woman is coming.
On all the parts we can apply on the cloth, the spirit, and then we can.
Yeah, we can use for emergency conditions. Yeah. The wire stimulation coding. Manjuna sir, please bunny. You barbeck bunny. No, bunny sir, please apply more. You'll get the opportunity. The time sikutte bandidira. Bunny sir, please. So sir code on the needle, directly. Yes.
15. Sir is not speaking right now. He's asked the students to needle those points.
उनको दिखाओ, उनको दिखाओ। Yeah, we can use random points. Yeah.
Is the video clear? Can you see the video?
दे उनको, somebody
Can you see
just
the
apply.
video?
एक apply करो.
Audio sir is not speaking right now. He's only asking students to needle and connect the electrostimulator. He's not speaking yet.
You just apply.
Yes, sir.
Yes. So you show this stimulator also. Yes.
Why is
And you
stimulator?
just. So now you connect these points. Yes. No problem. You connect now. ಕಡಿಮೆ ಮಾಡಿ, ಕಡಿಮೆ ಮಾಡಿ.
ಜಾಸ್ತಿ ಇದೆ ಸರ್. Actually, frequency is ಜಾಸ್ತಿ.
Yes, in this way, if there is any problem for 15 to 20 minutes, we can do the electrical stimulation to this particular points to treat and relax the muscles. If there is any sodium and potassium is not circulating, or there is any kind of the stagnation where the chi blockage is there on that particular region, we just activate this point. This open up the pores and open up the blockages, open up the energies where got the stagnation. This will going to help for especially. So this is the twitching also happening, and this twitching to be taken place when the patient have more vibrations internally, right? Hopefully we have seen this. Yes, now you can see, show here, yeah, how we'll getting the vibration. Yes, so like this we can activate. These are the points. Now we will proceed for, yes, now you just reduce it. Yeah, you just minimize, slowly minimize that. Now we just use the another point to be known as the Tian Chuang SI 15, 16, 15 is over, 16, yeah. Now please come forward, and then sir మీరు కొంచెం టర్న్ చేసుకుంటారా, కొంచెం ఇట్లా టర్న్ చేసుకోండి if you are comfortable. Yes, right. Okay, now please do have a look where this called as a Adam's apple. Sunara Sakhlin. This like a Adam's apple. From here, 3 chone lateral. That means 3 chone lateral. 1.5 chone lateral is Ren Ing, that is the stomach 9. This is the anterior border of the SCM muscles. Then 1.5 chone lateral to from this point is this point to be known as a which point? LI 18. Then half chone lateral to this point to be known as a which point is it? SI 16. Yeah, SI 16 point we just applied. This is a little vulnerable point. Please, who is not applied, please you just apply, Zainab. Yes, SI 16. Yes, now switch off that point. Now switch off that. Yeah, no, totally switch off. Now withdraw all this, especially yeah, electrodes. Yeah. Now we are treating to the vagus. Now how that activation to be taken place, please just have a look. Over. So this we are using is the 2 frequency. SI 16, that's called as a Tian Chuang. I'm just treating to the 10th vagus now. The whole body will going to circulate this by just activating the single point. Now you just see, you can see abdominal, till abdomen, you just focus how the vagus now is connecting to the till the anal region. I just touching to the skin, and you just apply somebody. Yes, you touch and then apply to the, yeah, 2 number is enough. Yeah, good.
Actually, can you see that twitching?
One alkodi. So, during 9 frequencies there we are touching to the first frequency, how they are getting stagnation, circulation. Now I don't use it without using the needle. I just apply without using the needle. I just apply where exactly this the Tian Chuang is there. We just activate like this. So this point is entirely head and neck, and heart, and then till the abdominal region he'll get the vibration. This called as a vagus nerve activation. दिख रहा है क्या उनको?
Yes, yes, yes.
Okay, good. So this, if you are not using the needle, we can use it the electrical. This is the pen stimulator. We can use just one single area to activate this particular nerve.
Without needle, this we
Yeah,
needle,
that's what.
is not,
That's enough.
It is okay. No, sir.
Yeah, that's enough, I mean to say. Yes, the next point is related to the vertically come below the jaw. The jaw will come here, the mandible, and then come here vertically below. This point to be known as a
17.
yeah, 17. Dr. Sai, please come. You just apply. This not the chin chin. This is the
17 is chin. 6.
yeah. Please apply here. SI
Yeah.
Tian wrong. Yeah. Good. So this is not much dangerous point. For what conditions we can use? There is the mandible related disorders and also the ear related disorders. We can use this point, and also lymphatic system where the lymph glands or the lymph nodes get stagnation. Even last night, evening 7 o'clock, 8 o'clock, I have seen the patient. Already they have operated for the lymphatic neoplasm or the metastasis or the malignant tumor was there, and they have treated, they have removed that cyst. So even for that condition also we can use this point. This is as a SI 17. Then SI 18 point is Chuan Leo. Chuan Leo, you just come down. This is as a outer canthus of the eye. You just come down. This is the zygomatic bone, and then you just come down here like this. This point to be known as a SI 18 is the Chuan Leo. So this SI 18 is really great point. झलक आप लोग कौन कौन प्लीज आप आ जाइए, कौन कौन अप्लाई, मैं नहीं बुला रहा हूँ, ऐसा प्लीज मत बोलो, प्लीज आप आ जाइए, आपके ओन इंटरेस्ट है, आप लोग सामने आना है. I'll give the opportunity to all of you. Correct. Yes. So SI 18. हाँ. तो अभी लास्ट पॉइंट क्या है? SI 19. Where exactly the thing on? This is the tragus. This is the antitragus. This is the tragus. So anterior to this, when the mouth is open, so we just use this point when condyle of the mandible maxilla will open. So once open, sir, you just open it. Yeah, it's open, isn't it? So then you just apply this point would be better. Yeah, you just apply here. Yes, in front of the tragus, you just apply in the depression. Yes. हाँ, यहाँ पे देख, here वो depression भी है, देखिए. Good. Good. Further, that should go deep. That should go deep. Apply further more. Don't worry. You just apply further deep. That should go the entire needle. Yes. Even 1 2 needle deep can be enter on that region. Good. Now ask them to slowly close the mouth. This is called as a palace of the hearing. That's called as a. There are the 3 points are there. You want it to apply as a through to through needling, 1 2 coding. So we just apply one needle directly here, or we just use it here. You just hold the skin. You just hold the skin and then apply from the upward direction to the downwards direction. So we just apply Orman, Tingong, Tinghui. There are the 3 points covered together. So we can activate one point, or we can use as a single point. That also advisable. Hopefully we have seen all these points related to the small intestine. Yes. Yeah, for hearing, exactly, for hearing. Now I just try to apply. I'll show you there are the 3 points here. So which we called as a, there are the 4 points I'll show you. Now, according to the TCM points were completed. Now we are just seeing the Tung acupuncture points. So, now 3 chun proximal to the SI5. The 3 chun proximal to the point, this point called as a, there are the 3 points are existing here. This is as a Chang Men. This is the 3 chun proximal. This point to be known as a Chang Men. Again 3 chun proximal to this region. Hey, please come somebody who is not applied. आओ माँ, आप लोग सब लोग आइए, मैं देखना है, ऐसा नहीं, आ जाओ आप भी, आ जाओ प्लीज़, लगाइए, आप लोग कौन कौन आना है प्लीज़ आइए. देखो मुझे हर एक बच्चे मेरे बच्चे जैसा, लेकिन आप लोग नहीं आते फिर हम कुछ नहीं कर सकते. प्लीज़ फॉरवर्ड, सामने आइए, प्लीज़ अप्लाई करो. और मैंने बोला आप बच्चे हैं मेरे, तो मुझे बाप जैसा आप बात करो, ठीक है? आप मत सोचो कि सर है ये, ऐसा मत सोचिए. I respect you all like my brothers and sisters and children, right? So then you just applied this. Then further from here 3 chun proximal. So 3 chun proximal again. This point to be known as a. You just apply one more point. Yes. Now the 3 points that's called as a, there are the three gates are existing. One to be known as a Chang gate, the other one is to be gun gate, the third to be liver gate, the third to be known as a heart gate. Now please listen, all of you unko suna raha hai ma? So there are the three gates on the small intestine meridian. Please register in your mind. One gate to be known as a Chang Men. Chang means is the intestine. Men means is the gate. Chang gate is existing here to treat for all the intestinal related disorders. The second gate to be known as a Kan. Kan means is the G-A-N. Pronunciation is K-A-N. Kan. Kan is indicating for the liver in Chinese. So there is the Kan Men. Men means again it is the gate. So Kan gate is existing here to treat for all the metabolism and liver related disorders. The third to be known as a Sia men or semen. C means again it is related to the men is the gate, and then sin. Sin means the heart. C means XI, means knee. XIN, sin means heart. So heart gate is existing here. So even last time also I told that heart gate is located here nearly 2 to 2.5 chun distal to the SI8 point. Heart related problem idre illi treatment kodbeku, liver related problem idre illi treatment kodbeku, ಮತ್ತೆ ಇದು intestine related idre illi ನಾವು treatment kodbeku. These are the, yeah, straight line only. All this posterior border. So posterior border on the small intestine, it's overlapping on all the small intestine meridian only, overlapping on the all the small intestine meridian. I think Meenakshi hai aap? Meenakshi from Kanpur. So for her, she was asking me there is the which point for the heart meridian, right? So just I'm showing you there are the another 3 points. So which point is connected to the heart meridian? This is also heart meridian points. 1 point, the 2 point. These 2 points are the 11.09 point. These 2 points also one or other way will be helpful for the heart. Then the second protocol, which I told you, the points which is located here on the kidney meridian. So we just use the point, this 1 point, there is another point. This both the points are good point for the treat for the heart related disorders. This is also, there is a 11.19, 11.09, 11.19. These are the 2 points also good point to treat for the cardiac disorder. Along with that 88.01, 88.02, 88.03. These are the 3 points also heart meridian point on the Tung acupuncture. No doubt the TCM acupuncture is this point. This is the Tung acupuncture point. See, we have a lot of formulas and related to understand about the various subjects, but you are studying the only one subject, acupuncture. In that, so don't get perplexed that, oh, I'm just confusion, something is like that. Nothing like that. Only the thing is you have to take it to your brain. It's very simple. You listen with your heart, then it is very super simple. Otherwise you just check with the PUC people or maybe the graduation mathematics people, how many chemical, biochemistry, organic chemistry, how many formulas they are going to keep it in the mind. There is nothing in front of that. That's the reason. प्लीज आप आराम से इस चीज को ले लीजिए और आप जस्ट एनालाइज करना, घर में जाके प्रैक्टिस करना. थैंक यू वेरी मच. आई जस्ट वाइंड अप नाउ.